Well, we started seeing some reports of single port laparocolectomy at our national meetings, and as a group we basically realized that this is a potential benefit to our patients. The operation itself, whether we're doing it for a non-cancerous problem or even in treating patients with colon cancer or rectal cancer, we're doing the same operation that we would have been doing open, laparoscopic, or with this single incision approach. And so that means that each step is the same, the resection is the same, the cancer-related outcomes are the same. We're utilizing the single incision surgery for most of the colorectal procedures that we perform. And so that includes resections of the small intestine and large intestine or rectum. We're utilizing it for diseases like diverticulitis, inflammatory bowel disease like Crohn's disease and ulcerative colitis, colon and rectal polyps, colon and rectal cancer. The concept of bringing all those incisions into one single incision is where the innovation lies. The nice thing about the gel point system is that the instruments actually move away from one another once you insufflate or instill carbon dioxide into the abdomen. It also allows us to pass different types of instruments, whether it be graspers or angulated graspers, allows us to utilize deflecting tip cameras and different energy and stapling devices. One of the other things about the gel point system is it's actually a two-piece system, one of which is a wound retractor that actually opens the very small incision that we make. I started off using the Alexis wound retractor as a very important part of my laparoscopic colectomies. And this is basically just as an evolution from the Alexis wound retractor. It allows us to put the gel point system on top of the Alexis, put all of our instruments through that same incision that we used to make at the end of the operation. Instead, now we make it at the beginning of the operation. When they wake up and we remove their incisional dressing on post-op day number 1, and they look down and they say, that's it, that's all there is.
I see the patients for all their first post-op visits, and patients are wearing jeans and are able to button their pants at their first post-op. They haven't taken all their pain medicine. They're ready to get back to activities and go to work. And they can't believe that the whole surgery is done through such a small incision.
I expected more pain, more longer recovery. I just expected all that.
With traditional open surgery, we would have the patient expect to be in the hospital for 7 to 10 days. So this has markedly decreased their stay.
My first question to them, when can I go back to skiing? I felt like I could do it right away.
Traditional surgery to the single incision laparoscopic surgery, we're able to do small incisions that either go right around the belly button or are tucked in a fold like a bikini cut incision. So patients are pleased. We often joke about it post-operatively that they can get back to their bathing suits in no time and no one will even know that they had surgery.
My reaction to my scar was kind of funny because I couldn't find it.
What struck me is how small it is. How you can get at least 3 or 4 instruments in that small a space.
Patients use the internet and they'll come in and they'll say, I found this information on the internet, or they'll tell you that their friend had surgery. The patients are becoming smarter and more of a consumer of healthcare, and they're looking for specialists and experts who can do smaller and smaller incisions for the better recovery and the cosmetic effect.
Well, our goal is to basically minimize the length of the incision and the number of incisions. And in doing so, we hope that this actually translates into less pain for the patient, a faster recovery, and less wound-related complications like bleeding, infection, or even hernia formation.
It's been amazing to me, even after being in the operating room for 18 plus years, to see the evolution going from what we accomplished, starting with open procedures, advancing to laparoscopic, and now we're doing it as a single port with going from an incision this big down to about that big. We
recently submitted a publication in DCR which highlights the use of the single incision laparoscopy for creating colostomies. And what it showed is that the procedure is safe, it's feasible, and actually facilitates the patient's recovery, in that there are no additional incisions outside of the colostomy itself.
I would recommend this to anyone who has these issues.
I think Dr. Makel has put together a terrific team, and I couldn't be more pleased with the outcome.
I've just had root canal, and root canal is horrible, and this experience was so good.